Medical science is constantly developing new and better drug treatments for a wide range of serious illnesses. But government delays in approving these new medicines as safe and then deciding if they'll be covered by provincial drug plans can leave patients waiting 2 years for potentially life-saving medication. A wait that can have a drastic impact on people's lives.
And I asked my doctor when she told me what the price was. I said, "Doctor, am I going to have to sell my house?"
Find out more on this edition of Fraser TV. The delay in gaining access to medications begins with Health Canada, who first must decide if the medicine is safe and effective for public use. People with private drug insurance usually get coverage for new drugs as soon as they're approved. But people who rely on provincial drug programs must wait for their government to decide if and when the new drug will actually be covered by public insurance. Doris Patko is 82, but still lives on her own and keeps herself active and healthy.
I'm a senior, but I'm active. I'm an artist. I do jewelry.
But Doris's life changed when she was diagnosed with wet macular degeneration, a disease that's treatable with several new drugs.
You lose the vision in the central part of your eye. There's a blur. I have 2 granddaughters. One is engaged, and I kept thinking, am I going to be able to watch my granddaughter walk down the aisle? And it just tore me apart. The treatment that was recommended was a monthly shot in the eye, and it wasn't covered by medical. When I realized it wasn't covered, it felt like the rug had been pulled out from under me. I felt helpless, totally helpless. If I had to paid for that treatment on a monthly basis, it was $1,800. It wouldn't be long before everything that I had saved and my husband had saved for our retirement would have been gone. I was diagnosed with the wet macular degeneration in, I believe it was October of last year, and the treatment that was recommended had not been approved until June of this year, so I had to wait 8 months.
The Fraser Institute's Brett Skinner is the author of Access Delayed, Access Denied, a study that looks at the delays for approving new medicines that can help people like Doris.
Well, after patients wait very long periods of time, more than a year, for Health Canada to approve a new medicine as safe and effective, they then have to wait long periods of time for the provincial governments to approve those medicines for reimbursement under the public drug plans. But, that doesn't mean that patients will get ultimate access to some drugs, because many drugs are not approved at all by provincial drug plans. And that results in lost potential health benefits from a lack of access to those drugs.
Doris was fortunate that the BC government eventually decided to cover her medication. But Skinner found that only 10.1% of new drugs approved by Health Canada as safe and effective in 2007 were being fully or partially reimbursed under provincial drug plans by the end of 2008.
This is a really important issue for our healthcare system. We really have to find ways of speeding up access to new medicines. My first recommendation is regulatory cooperation with other countries. Health Canada currently replicates the process of the United States Food and Drug Administration and the European Medicines Agency in the European Union. That's an unnecessary and wasteful step, because we have similar safety standards and similar approval standards for new medicines. So we should really be sharing data, sharing resources, information, expertise, and not duplicating the processes of those other countries. We would save money and we would save time, and new medicines would come to market faster in Canada. My second policy recommendation is to replace government drug programs with greater access to private drug insurance. Well, we know from experience and evidence that private drug insurance offers better benefits, greater consumer choice, quicker access to new medicines than what we see being offered under public drug programs run by governments. So why not just get more people into private drug insurance? Why not make it possible for more people to enjoy the benefits of private drug insurance? And there are a number of ways to do that, but probably the easiest way is to subsidize the income of people who can't afford private drug insurance so that they can have access to the kinds of benefits that are currently enjoyed by those people who obtain private drug insurance through their employment, for instance.
For more information about waiting times for new medications and to find out some recommendations on how to improve the system for patients like Doris, check out our complete study, Access Delayed, Access Denied, at FraserInstitute.org. That's it for this edition of Fraser TV. I'm Leah Costello. Thanks for tuning in.